even on his clothing. I'll explain why those don't really get in the way. He will display himself as a living human being. He's living. He's turning left. Appreciate that, Mike? Maybe not so much that you can see, but he feels it quite clearly. And I can feel it. I've got my hand out. Can you see his chest wall moving with his heart? No. But you could feel it, right? There are all kinds of things that are palpable in the system that are not visible on the surface. And this motion, what you will come to understand as idiomotion, is one of those things. Mike goes where Mike wants to go. He stops himself when I change the context. When I change the context again, when I put him in the casino in Atlantic City, like I was talking about, he begins to change his behavior. Now he's turning right, clearly to the right. Appreciate that much? Large motion, much larger on the inside than on the surface, and now you're beginning to see the tipping to the right, and this is visible as well. Now, in conjunction with this motion, which is a dance, this is a dance, and he leads. He leads. He's Fred Astaire, I'm Ginger Rogers at this point. He leads. In conjunction with this, the characteristics of correction will emerge. They are written out for you, and I will talk about them over and over again. Characteristics of a corrective maneuver, the untwisting of the system, are four. And the first is warming. Warming up somewhere?
Yeah.
Where? Not where my hand is necessarily, might be there. What makes us warmer? I'll give you how many things make us warmer? I'll give you the first one, blood flow. What's the second? Huh? Well, it's a trick question. There is no second one. Okay, that's it. Okay, blood flowing to the surface. Blood flowing to the surface is what makes us perceive warmth. Okay, how long does that take? As I say to my patients these days, remember when you were young enough to blush, and they always laugh, and how quickly that could happen. How you could not control it, and how hot your face felt. And when I blush, I look like a stop sign, for heaven's sake. The body's ability, our ability, to bring blood to the surface is really markedly acute. We're good at this. And he's feeling the warmth in his system, not secondary to the embarrassment, but rather secondary to something else. And that's something else we're going to talk more and more about. But he's feeling warmer, and that's no small thing. Yes?
In terms of contacts, if a patient comes in and you're going to do this very gentle treatment with them, how would they react? I mean, Mike's a therapist, so he's very comfortable letting himself